trained to do it. That's correct.
Do that.
That's correct.
What's the training process like? How difficult is it?
We have, through the company, they have trainers that'll go out. I don't know how many sessions, but it's several sessions. You guys have an idea?
Yeah.
One session. Wow, they've gotten that good. One session.
Right.
It's very intuitive. I mean, the device is really intuitive. You just, if you examine, if you're thinking about examining your breast, you are pushing from the skin down onto the chest wall.
Right.
And you're doing it in a pattern around the breast.
Right.
Same idea. You're going to push down, not that hard. It's actually, the device will give you a color to show that you're pushing hard enough, but not too hard. You know, so it gives you good feedback. And you do a pattern on the breast for screening. So it's very intuitive. And I found in my office that my nurses are better at using it than I am. And and that's probably because I'm overthinking the use of it as a physician.
Right.
Whereas if someone approaches it without having done tons of breast exams and operated on cancer, they probably don't have to put that much thought. It's pretty simple, and it works really well.
And so you currently in Malaysia and a number of countries, obviously, you have mammograms, then you have ultrasounds.
Yep.
But then those are things that you have to go to a facility.
Yes.
And what I like about these kind of devices is the fact that these devices come to you. You can literally do it at any place, and obviously screen larger population, get more data, and from that data, who's at risk and who's not at risk.
Right.
Because like you were mentioning just now, when you're looking at risk people, the government has to deem them to be at risk and then test them.
The doctors, yes.
Yeah, the doctors. But I don't know whether that really happens regularly enough. And obviously something like this might pick up something that would save a life.
I think so. I think that's the concept behind it, especially in this format.
Yeah.
There's some other benefits that come with this when you throw a health care event or a health fair and you're doing blood pressure screenings and showing them this device. You're introducing the concept of screening for breast cancer, which culturally is not a thing right now here in Malaysia. So as you throw that event and you have people come in and speak and women see this and it doesn't hurt and it's not no radiation, they may feel more comfortable with the concept of screening, and maybe they go for this every year.
Right.
Or maybe they start going for mammograms every year.
Right.
And, eventually you can have the support of the system so that can be provided for these women.
So just to be clear on it, this is a sort of a pre-screener. And then if there is a lump, it doesn't tell you whether it's cancer.
Right.
If there is a lump, then you need to go for a mammogram.
Additional imaging, a mammogram, ultrasound,
right.
Some kind of additional imaging to figure out what it is and whether a biopsy needs to be done, et cetera.
Okay. So the stages of this would be, if there's a lump, then go for a mammogram. And if it indeed finds something, then you have to do a biopsy.
Correct.
And then after that, if necessary, treatment after that.
Yeah, surgery, chemo, radiation, whatever it is. But the next step in diagnosis after mammogram, ultrasound, some sort of, oh yes, this is worth sticking a needle in, is a biopsy. We stick a needle in and check. Is it a cancer? Yes. We have to do something about it.
Yeah.
Not a cancer. It was benign. Don't worry about it.